Oh, I am excited to talk about the elotuzumab in combination with pomalidomide and dexamethasone in relapsed myeloma. I had participated earlier on elotuzumab with lenalidomide and dexamethasone, and we noticed that it is an excellent combination. It is well tolerated. It is well tolerated by elderly patients, and the responses were durable and with long-term follow-up. This is one study where they had followed for a long time elotuzumab, lenalidomide, dexamethasone, and it showed the benefit all the way through. So that was a benchmark study. So then we were interested in using pomalidomide because lenalidomide is now used more in the upfront in combination in triple therapy. So when the patient relapsed, we wanted to see how about combining elotuzumab with pomalidomide and dexamethasone. So we started a phase 2 trial, and the results of which I am presenting today on behalf of my colleagues. But at the same time, a phase 3 trial was conducted, and the results were out in the EHA, and the FDA has just given approval for the combination of pomalidomide, dexamethasone and elotuzumab. So it's really an appropriate time for me to share the results of our phase 2 trial. We had treated 68 patients, and we noticed that half of the patients responded very well to this treatment. The progression-free survival was 11 months, and especially patients who were in first relapse, who were on the pomalidomide, dexamethasone, elotuzumab, they did even better with the progression-free survival of 13 months. And as I expected with the elotuzumab, with lenalidomide, dexamethasone, this is still ongoing, and I believe that the patient who was staying on the study will continue to stay on and do well. And as a reference point, if you look at the pomalidomide, dexamethasone with elotuzumab and without elotuzumab, in the control arm without elotuzumab, which was reported in EHA, they showed that the response rate was only durable about 4 months, whereas when you use the pomalidomide, dexamethasone and elotuzumab, it was 10.1 months. So the response rate doubled, the duration of response doubled. So that was, the control arm was about 60 patients, and this is an additional 68 patients in the same population. So you have results of 128 or 129 patients giving validity to the data which was already reported in randomized trial. And I believe that is what led the FDA to say, okay, this is an important study that, trial, and this is something that should be approved for the patients.